Hello everyone, welcome to the series on medical emergencies in dental practice. Today we will talk about a rare but critical condition that can occur in patients with untreated or incompletely treated hyperthyroidism. In this video, you will learn how to identify the warning signs, manage the situation in a crisis, and ensure your dental treatments are safe for these patients. Knowing this information could literally save a life. We have prepared a detailed note on this topic so you can download our app and access it there. Now, before moving forward, if you haven't subscribed to our channel, then do hit the subscribe button so that you never miss an update from our channel. Your support keeps us motivated to make more such informative videos for you. So, starting with today's topic, thyrotoxicosis and thyroid storm or crisis. Thyrotoxicosis or hyperthyroidism can result from excessive production of endogenous thyroid hormone by the thyroid gland or excessive administration of exogenous thyroid hormone. Thyroid hormones increase body's energy consumption and elevates basal metabolic rate. This usually results in fatigue, weight loss, palpitation, and heat intolerance. However, in some patients, dysregulated thyroid levels can lead to cardiac abnormalities such as arrhythmia, heart failure, and even cardiomyopathy. These are related to the direct action of thyroid hormones on the myocardium. On the other hand, thyroid storm or crisis presents as an acute life threatening situation with severe hypermetabolism and several systemic dysfunction. It occurs in case of untreated or incompletely treated thyrotoxicosis and can be precipitated by some form of stress, intercurrent disease, infection, trauma, thyroid surgery, or radioactive iodine administration. The primary difference between thyroid storm and severe thyrotoxicosis is the presence of hyperpyrexia. The body's temperature may reach a lethal level of 105 degrees Fahrenheit or higher within 24 to 48 hours if left untreated. The first clinical signs to be noted in thyrotoxicosis are nervousness, increased irritability, and insomnia. There is intolerance to heat and hyperhidrosis, that is, a marked increase in sweating, warm and moist skin, overactivity, including quick, uncoordinated movements that range from mild to gross tremors, rapid speech, unexplained weight loss accompanied by an increased appetite, fatigue, and palpitation. The cardiovascular manifestations include increase in blood pressure, systolic more than diastolic, widening of the pulse pressure, sinus tachycardia, more during sleep, and occasional paroxysmal atrial fibrillation and heart failure. Now, coming to acute thyroid storm, it presents with hyperpyrexia, excessive sweating, nausea, vomiting, and abdominal pain, cardiovascular disturbances such as tachycardia and atrial fibrillation, heart failure with possible pulmonary edema, CNS manifestations such as mild tremors, agitation and disorientation, psychotic behavior, stupor, that is partial unconsciousness, and eventual coma. Some of the diagnostic clues that can be helpful in diagnosis are sweating, heat intolerance, tachycardia, warm, thin, soft, and moist skin, exophthalmos, and tremors. So, now that we know what the condition is and how it presents, let's look into the management. First of all the dental treatments should be terminated and the patient should be placed in a supine position with the legs slightly elevated. Check circulation, establish a patent airway and assess breathing, call for medical assistance, and administer oxygen as needed. Administer IV fluid such as 5% dextrose, ringer lactate solution, or normal saline, and shift the patient to a medical emergency facility for definitive management. The definitive management includes administration of large dose of antithyroid drugs such as propylthiouracil, propanolol to block the adrenergic mediated effects of thyroid hormones, and large doses of glucocorticoids to prevent acute adrenal insufficiency. Other measures include oxygen, cold packs, sedation, and careful monitoring of hydration and electrolyte balance. At last, some of the considerations for dental treatments include dental care should be postponed until the patient's underlying metabolic disturbance is corrected. Use of atropine should be avoided. Epinephrine and other vasopressors should be used with caution in clinically hyperthyroid patients. Local anesthetics with vasoconstrictor may be used with following precautions. Use the least concentrated effective solution of epinephrine. 1 is to 2 lakh is preferred to 1 is to 1 lakh, which is preferred to 1 is to 50,000. Inject the smallest effective volume of anesthetic vasopressor, and aspiration should be done prior to every injection. Use of racemic epinephrine is absolutely contraindicated in a clinically hyperthyroid patient since they are unusually sensitive hyperresponders to catecholamines such as epinephrine and responds with hypertensive episodes, tachycardia, or significant dysrhythmias. Hyperthyroid patients may seem apprehensive, which may suggest the need for sedation during dental treatment. However, sedation may prove futile as the anxiety is not psychological but hormonally induced. So that was all about thyrotoxicosis. In the next video, we will take on another medical emergency and its management. Till then, if you found the video helpful and informative, then do like the video, share it with your friends, and subscribe our channel for more such informative content.